A hospital stay is hard work. Examinations, tests, and procedures can be exhausting and stressful for any patient, but especially so for the hospitalized elderly. Therapeutic activities encourage socialization and promote mental stimulation. They can help restore a sense of balance to a patient's disrupted life, boost their self-esteem, and lead to a faster recovery.
So the goal of the Therapeutic Activities program is to try to keep the patient cognitively stimulated while they're in the hospital, again with our overall goal of the program trying to prevent confusion during hospitalization.
We're working with a group of people who think that when you're sick, you get in bed, throw the covers over your head, and come out when you're well. And that might work if you're 20 or 30 or 40 or even 50, but when you get older, you can't just lay in bed and let the covers go over your head.
When the patient is in the hospital and they're just laying in the bed, it's not good. Physically is not good, socially is not good, psychologically is not good, cognitive is not good. So therapeutic recreation offers the patient a way, a channel to maintain those abilities.
The therapeutic recreation protocol of the Elder Life program has two arms. First, it encourages patients to participate and interact socially, mentally, and physically through enjoyable one-on-one activities. Second, it offers relaxation and sleep techniques to help relieve anxiety, stress, and pain and promote sleep.
In the Elder Life program, we do therapeutic recreation activities 3 times a day. And the reason we do that, it serves 2 very important purposes. One is it distracts people from their problems, their pain, their worries, just laying in the bed and not doing anything. And the other thing is it helps stimulate them mentally or even physically.
Participating in the therapeutic activities can help to improve a patient's self-esteem and lead to a faster recovery. Although designed to appear informal, therapeutic activities use a carefully planned approach that should be followed consistently. The goal for volunteers is to engage the patient one-on-one for at least 10 minutes 3 times a day in activities the Elder Life specialist has pre-selected to meet the patient's interests, needs, and abilities. As with all of the other protocols, patients have individualized care plans that change based on ongoing evaluations by the Hospital Elder Life program medical team and staff.
You have to keep in mind that patients are sick. Patients are feeling pain in their body, so they may react in a negative way that you're not expecting.
And they don't really have an opportunity to exercise their minds the way they're used to at home. So using an enormous amount of questions, having the patient talk about themselves, tell me about their lives, tell me about their families, just so they can express themselves.
It's nice to see you.
Thank you. It's nice to see you too.
Oh, I'm glad.
The goal for volunteers is to present the therapeutic activities in an enthusiastic way that encourages patient participation and gives the patient highly focused individual attention. The one-on-one visit guidelines are simple but effective. Get the materials you need before entering the room and introducing yourself.
Hi, my name is Lorenzo.
Be sure to smile and make eye contact.
Oh, and this.
Encourage patients to use glasses and hearing devices.
Yes, it's good.
Before I start, Mr.
Speak slowly but clearly. Remember that touch can be comforting. Ask open-ended questions that invite conversation, and then be a good listener. And, as with every protocol, make sure to wash your hands before beginning the activity and after you leave the patient.
What we like to do in the morning is start with current events because that helps orient the patient.
Where's that CNN?
Good morning, Mr. Wilson. Hi, my name is Lorenzo.
Oh, yes, Lorenzo.
Yes, I'm a volunteer with the Hospital Elder Life program.
Yes, it's nice to see you again.
Nice to see you again. I just happen to have here the newspaper. Would you like to read it?
Oh, yes. Yes, please.
Okay, you know, we could first put on your glasses, right?
Yes. Thank you. At home, I usually spread it out on the table.
Okay, that's no problem.
I don't feel like holding it.
Yeah, we have the tray table here for this purpose.
Oh, good.
So what page would you like to start with?
Well, I start from page 1 and go to the end, doesn't everyone?
Oh, okay. Yeah, right. That's fine.
All right.
Let me move this stuff out of your way, right? There. You don't mind if I read with you, do?
No, not at all.
Okay.
that. Can you believe it?
The volunteer can follow the patient's queue with current events for material. It can be a newspaper, a magazine, or the TV news. Act as a facilitator by reviewing headlines, reading articles, and discussing topics together, but be careful not to dominate the conversation.
Do you think we're gonna get any of that weather up here?
It usually goes out to sea.
Encourage the patient to relate opinions by asking questions and listening actively. Review important dates and times of major events as a way to keep the patient oriented.
Doesn't it say we're gonna get some of that storm, some of that bad weather up here, and like by Friday, in 2 days from now?
Yeah, well, that's how long it takes to get up here as a rule. That's what I meant.
The Reminisce activity offers patients a way to share experiences from their lives. The various How Things Have Changed cards recommended for this activity are pictures with descriptions and questions to stimulate conversation. As an active listener, you can pick up on patient comments about past experiences that may tie in with the present.
Yeah. Before, we used to go to the neighbors and use their...
Review important points and major recollections. This gives you an opportunity to orient patients to the present.
Once a day.
Why?
Well, my mother didn't want us to stay on the phone like they do nowadays.
We'll bring out reminisce cards that are pictures of what people have done in the past and show old-fashioned cars, old-fashioned telephones, Ringer washing machines, and it gives patients a chance to identify something that happened to them in their youth, talk about it, teach us about it, and they kind of become the teacher and historian.
You know, if you say, well, what did you do during World War II? You get these incredible stories, or, you know, how were things during the Depression? It's really wonderful. So, and for them, it allows them to open up and tell things about their past that, you know, sometimes probably even their children or their grandchildren really aren't interested, or they've heard it too many times, or they're too busy, but now they've got someone they've never told this to before, and they just really light up. It's really wonderful.
You bring activities such as like, what is the old type of car that you like? Tell me about it. What car did you like in the past? Or you talk about their families. You know, what did you do when you were younger with your mother, your father? Did you have activities that you enjoyed doing with them? And the patient really enjoyed going back sometime, and they're pleasurable activities.
Other therapeutic activities include trivia, card games, arts and crafts, and encouraging the patient to pursue some hobby or interest, such as knitting or jigsaw puzzles. Volunteers check their assignment folders before going into the patient's room and get whatever supplies are indicated.
Good luck to you, dear.
Thank you.
Oh,
Excuse me. Hi, good afternoon. Mrs. Levine. I'm the afternoon volunteer.
If a patient has family or friends visiting, volunteers can encourage their involvement as well.
You're welcome to stay while I visit with your grandmother.
Oh, well, I don't want to interrupt, so Grandma, I'm going to go have some lunch.
I came in this afternoon to just do some trivia with you and some talking and to help pass the afternoon.
okay.
And your granddaughter will be back up in a little while.
Okay.
I have great photographs that are just fun to talk to about old times. Do you remember who this is?
Oh, Clark Gable.
Yes, yes it is. Do you remember?
I loved him. And I remember the shows the plays he was in, Gone with the Wind,
Yes.
and it happened one night. Oh, that was so funny.
I didn't see the movie. Can you tell me about it?
Well, it was Clark Gable with, oh, what's her name? I can't think of her name. That's it. That's her. What was her name?
Claudette?
Claudette Colbert.
Good.
That's right.
Yeah.
And I remember the scene when he took off his shirt, and all the people in the audience saw that he wasn't wearing an undershirt, and the undershirt people went out of business.
Oh no! Oh, that's something.
That was so funny, that scene. I loved it.
Yeah, I never saw the movie. It's good to hear that.
It's hard to sleep in the hospital environment. We've done some work with nurses on the night shift to try and make sure that the units are quieter. We look at medication schedules to try and make sure medications aren't scheduled for the middle of the night. We're probably one of the few people who say, well, what's your normal sleep habit? Which is important, because if somebody usually goes to bed at 1 o'clock in the morning and gets up at 8 in the morning, being upset that they're not going to sleep at 10 o'clock at night in the hospital is not a big deal.
Because routines are so important to elderly patients, the sleep protocol works to minimize distractions, make the patient more comfortable, and provide an evening routine that will lead to a restful night without the use of sleep medication if possible. When you visit a patient for the sleep protocol, explain what you will be doing to help the patient prepare for sleep.
Mr. Wilson, would you like to go to the bathroom?
For most patients, this activity might begin with a trip to the bathroom.
Would you like something warm to drink?
Begin the sleep program by offering the patient a choice of warm milk or herbal tea.
Okay, Mr. Wilson, here's your milk.
Next, prepare the room for sleep. Close the door to discourage interruptions and decrease noise. Draw the privacy curtain and turn off the TV or radio. Turn the lights off and turn on soothing music. After the patient has finished the drink, have him lie on his side for a 5-minute back rub.
Okay.
Apply warmed lotion in slow rhythmic strokes on both sides of the spine, starting from the head and moving to the base of the spine. Include the shoulder and lower back areas, but do not massage directly over the spine.
What we do in the evening is we offer the patients warm milk, herbal tea, relaxing music, and a back rub. This helps to relax the patient so that they sleep well at night without having to take medication, which causes them to be groggy and sometimes disoriented. A good night for me is when I go into the patient's room and they greet me. And when I leave, they're happy, relaxed, and sometimes sleeping before I leave. Then I feel like I've done a good night's work. Good night, Mr. Wilson.
The relaxation protocol is a way for volunteers to help patients help themselves.
Shots, you know, and I just don't feel good at all.
Well, there's something that I can teach you and show you how to use that will help you to relax and feel a little bit more comfortable. And this is something you'll be able to do on your own later on, too.
That would be very nice if it would help me. I sure need it.
Great. And when you relax the pain, you'll notice it less.
When you visit a patient to demonstrate relaxation techniques, begin by making sure the patient understands how this will help them. Then ask the patient to sit or lie down comfortably, assisting them as needed. Close the door to discourage interruptions, draw the privacy curtain, and turn off the TV or radio. Turn the lights off and turn on soothing music. Then, in a voice that is quiet and slowly rhythmic, begin the exercise by asking the patient to describe a relaxing setting they've visited. You'll be asking them to visualize that place later in the exercise.
The first part is to regulate your breathing. So we'll start.
How do I do that?
By breathing in deeply, 2, 3, and out through your mouth. In through your nose and out through your mouth. Once more, that's perfect. In, 2, 3, and out. Okay. You can close your eyes or you can leave them open as you wish. And I'll ask you to stretch out your hand a little bit. That one looks very relaxed. Let's get this one a little bit more relaxed too. Okay, just so you're nice and comfortable. We're going to start with your feet and work your way right on up to your neck. Okay? First of all, curl your toes in and hold them tightly. Release. It's a small motion, curling your toes and release. Let the stress leave that part of your body. Okay. You can relax and you can...
The volunteer should do repetitions 3 to 5 times before moving on to the ankles, the knees, the buttocks, the spine, the shoulders, and so on up to the neck. Make sure the patient is breathing slowly and easily. After reaching the head and neck, ask the patient to picture themselves in the special place they said they enjoyed.
Hear the waves crashing on the shore. Feel the sun.
Once the patient is completely relaxed, allow some time to picture this special place. The purpose of this exercise is not to put patients to sleep, but to relax them. Trust your instincts. So before they fall asleep, say that you need to go back through all the parts of the body and gently wake them up.
Shake your legs a little bit so you can feel it all the way up to your hip.
Starting again with the toes, this time suggest wiggling the toes, turning the ankles, shaking the legs, and so on. After you've reached the head, suggest a deep cleansing breath, followed by a moment of quiet.
In, deeply, and out. How do you feel?
Much better.
That's great. You can do that anytime you need it or you feel you want it to help you relax.
Thank you.
It's my pleasure.
At the end of any of the therapeutic activities, volunteers need to do the following. Thank the patient before leaving and tell them who their next volunteer visitor will be. Wash your hands and leave. Return any activity material to the designated activity area. Document your visit, including any special interests or significant comments of the patient. This will help with adjusting future interventions for this patient. Report any problems to the nurse or elder life specialist. Therapeutic activities make interactions between volunteers and patients stimulating and enjoyable encounters that both parties look forward to and that speed the patient along the road to recovery.